Good morning, and thank you for joining this virtual press conference. Today, we are marking a significant milestone in our collective fight to combat the opioid crisis. Starting today, Buffalo, Erie County, Western New York, and all of the other counties in New York are officially receiving the first dollars from our opioid settlements. These funds will go directly into treatment, prevention, and education efforts. And these funds will have an immediate impact. These funds are a result of our litigation against Big Pharma for the devastation and the destruction that they have caused, not only in New York, but all across this nation. The devastation and destruction that has claimed so many lives and impacted so many families. I want to acknowledge Erie County Executive Mark Poloncarz and Buffalo Mayor Byron Brown for all the work that they have done to help our communities. As a result of these settlements, starting today, Western New York will receive more than $12.8 million. Erie County will receive more than $8.3 million. The city of Buffalo will receive $582,000. In total, all 62 counties and the 5 largest cities will be receiving $197 million. I want to be clear that this is just the first of more money to come. And it's only one piece of the up to $1.5 billion settlement that we achieved with some of the distributors and manufacturers of the opioid crisis. And it only represents payments for this year, 2022. But the reason we can distribute these funds today ahead of other states is because of the hard work and the cooperation of every county and every municipality in the great state of New York. And it's important that we were able to do that because it means we can save lives today and tomorrow, that we can get funding on the ground so that we, again, could address this crisis. It means that there are more resources in our communities today to teach our young people about the dangers of opioids, prevent someone from misusing a painkiller for the first time, treat individuals who are struggling with addiction, and save people from dying of an overdose. 2020 was the deadliest year for overdoses our country has experienced, and those numbers continue to go up in 2021. And while there's no dollar amount that could ever make up for what we've already lost, all of the lives that we lost, all of the children that we've lost, these settlements will prevent drug companies from this deception in the future, help New Yorkers end the terrible cycle of hopelessness that opioids have caused, and more importantly, save lives going forward. Several years ago, I made a promise to families that have been torn apart by this crisis. I promised to hold these companies accountable. I promised to bring some semblance of justice for what was taken from them. And I promised to do everything in my power to turn the tide on this crisis and stop future destruction and pain. These funds will go a long way in supporting those who need it the most. And so I want to thank my colleagues in government. I want to thank them for their cooperation. I want to thank them for joining me to address all of the pain and destruction that opioids have caused. And so now it's my honor and my privilege to introduce Erie County Executive Mark Poloncarz.
Thank you, Madam Attorney General. And on behalf of the people of Erie County, I want to thank you for the incredible work that your office has done to ensure that the people of Erie County, Western New York, and all of New York State receive a significant amount of the settlement. As the Attorney General knows, it is a united effort to address the issue of opiate addiction. We have all worked together for quite some time now to reduce the flow of illegal opiates to our community, but also to address it as best as we can, starting so that people don't get addicted in the first place. And I want to thank her and her office for the tremendous work that they've done to assist us through the years to reduce opiate addiction's impact in our community. And I also need to thank Mayor Byron Brown. As I note, this is a unified effort, and the city of Buffalo has been a key partner with the county of Erie for years now to interdict and stop opiate addictions from occurring, and then also to get those drugs off the street when they sometimes are involved, such that the City of Buffalo Police Department has worked with our Department of Health and Department of Mental Health on cutting edge technologies to ensure that we can stop the flow of drugs in our community before they get in the hands of people and unfortunately often result in death. So I want to thank the mayor and his great team in the city of Buffalo for all that they do. Because of the work of the Attorney General, Erie County is expecting to receive $1.3 million this month. Will be coming out, we'll be receiving it, and it's going to be used for direct assistance to ensure that we're addressing the needs of our community with regards to opiate addiction. There are restrictions on these funds. They're just not going to go into our general fund and be used for any purpose. And this is just the first payment. There will be many more that will be coming for years now, including some later this year as well. So I want to thank the Attorney General and her team for all that they've done to ensure that they're fighting to get these drugs off these streets, to hold those that were accountable. The prescription drug companies, the distributors, are the ones who created the opiate addiction crisis in America by force feeding in some ways these drugs on Americans, saying they were safe and they were not harmful. As we know, they're not safe and they are very harmful and have killed too many of our fellow citizens. So I want to thank all for their tremendous work, and the Attorney General's office for their steadfast determination to ensure that they ended up with a settlement that was fair for the people of our state. And this is a settlement that is fair for the people of our state, and the dollars will be used to stop drugs from coming into our community and to help those that are addicted get off their drugs so that they can once again lead their best lives possible. Thank you.
Thank you, County Executive. And now I'd like to introduce Buffalo Mayor Byron Brown.
Thank you very much, Attorney General James. Thank you for your leadership to battle opioid addiction in our state and certainly in our local community. The resources provided from these settlements will be helpful in our efforts to battle opioid addiction in the city of Buffalo. I'm certainly very grateful for the work that you have done, Attorney General James, the tireless efforts of you and your staff in fighting the large drug companies who created this crisis in our communities in the first place. I also want to recognize and thank my partner in government at the local level, County Executive Mark Polenkars, who has taken tremendous leadership on this issue locally in Erie County for his partnership, for the work of his staff, and for the way that we have been able to collaborate to provide hope and healing to the residents of our community. Through your work, Attorney General James, this month, the city of Buffalo will receive over $500,000, as you noted, in these settlement funds. And like County Executive Polenkars, we will use these resources to assist people in our community that are suffering with opioid addiction. Again, I am very thankful for your leadership on this issue, your partnership, and your resolve to address opioid addiction in the state of New York. Thank you very much, Attorney General James.
Thank you, Mr. Mayor. Allow me to also recognize and thank our law enforcement partners, the officials, and all of those who work collectively all throughout the state of New York, working with my office to address the scourge of drugs as we interdict and as we combat drugs and the violence associated with us in the great state of New York. And at this time, we will take some questions.
Great,
Reporters?
thank you. So if you have a question for the panelists, please raise your hand on the raise hand function, and we will call on you then. Okay, our first question is going to come from Emily Gersh. So Emily, you can go ahead and unmute yourself and ask your question.
You're muted, Emily.
Ooh, sorry, too early. Mr. Polenkars, could you comment on where the numbers in Erie County are trending right now compared to where they have been in previous years? Thank you.
Well, unfortunately, we've seen an increase in the last year with regards to opiate overdoses. We had as everybody I would hope knows, we had a really good trend line going into 2020. We had some very bad years in 2013, 14, and 15. The whole community worked very hard. We were able to drop those numbers dramatically to the point that Erie County, the city of Buffalo, was being used as evidence of the best practices to address the opiate addiction crisis. And then, of course, with the pandemic, we did see an increase in 2020 and 21. However, it's not exactly the same as it was before. What we're often seeing is back in 2014, 15, it was an issue with heroin. Now it's an issue with fentanyl, and fentanyl being used in products like fake prescription drugs or the spiking of cocaine. I mean, it's been kind of a joke to some people when I talked last year about be careful with cocaine because it's being spiked with fentanyl. But what we're seeing is a lot of individuals who were not what would be considered traditional opiate users overdosing that were using cocaine. And the problem is if they use cocaine and it's spiked, they then get addicted to the cocaine, which is spiked with fentanyl. And what we've seen recently is not as many deaths as we had in the past with regards to younger people, but often older people who are habitual cocaine users. I don't have the exact number on deaths as of 2022. We can get that from the Department of Health. It takes some time for the confirmation of deaths. We do believe, based on the number of overdoses that we've been seeing in the community, we are doing better than we were in 2020 and early 2021. But we'd like to get back to the point where we were a few years ago, in which we were declining in overdoses and deaths. And the reason that happened is because of a unified effort by all on the state level and on the local level to address this in every way possible. And we're going to continue working hard to make certain that that older trend continues.
All right, if there's any other questions, go ahead and raise your hand in the chat function. All right, looks like we have a question from Sandra. Sandra, we're going to get you unmuted. Okay, Sandra Tan, you can go ahead and unmute yourself.
Yes, thank you. I was interested to know, either for the mayor or for the county executive, if you know specifically what agencies or organizations this money will be used to support.
Sandy, we're going to evaluate that, working with members of the community, working with the county executive to determine the organizations that we're going to support. There are a number of organizations in the community that are doing tremendous work in providing services to people that are dealing with opioid addiction. We will certainly be looking at those agencies to provide resources. Also, the city of Buffalo has a new unit of our police department, the behavioral health team that works with clinicians. That is a unit that provides support also to individuals in our community who are dealing with opioid and other forms of addiction. So that could potentially also be an area where we would use resources.
Sandy, the county, as you know, has had a longstanding opiate task force, which has worked on this issue. The main coordinator of it is Cheryl Moore. I was talking actually with Cheryl yesterday about our plan. And one of the things that we couldn't really do is until we actually have the dollars, you can't start going out there and like sort of advertising that the money's coming until you actually have the amount and know exactly what you're going to get. So we're going to do it like we did in the past. We are going to work with our partners. We're going to try to find out and determine from them what they feel are the best uses of the dollars. We are not going to just spread it to agencies, but we want to ensure that we get the best bang for our buck, so to speak, by putting it forth in the programs that we know work. So now that we're going to receive at least the first payment in Erie County is about $1.3 million, and there's more that will be expected in later this year and then in future years. we're going to take the plan that we sort of have in place, the existing plan on dealing with opiate addiction, and now that we have additional dollars, are going to be able to help fund some of these programs that we know work and expand them to even a greater degree. But we don't have exactly the names of the organizations that are going to receive the additional fund, because we sort of want to see what they're also the best thoughts that they have for using those dollars are. Just because we got it doesn't mean we're going to spend it today, but we are going to get it out the door very soon so that it's out there saving lives.
Thank you all. That's all the questions that we have for today. So we're going to wrap up. Thank you for joining.
Thank you, County Executive, Mr. Mayor. Have a good day.
Thank you, Madam General. Mr. Mayor, be safe and well to all.
Okay, thank you.